Hello, this is Angelia, and you are listening to or watching the podcast Why You Do What You Do, the podcast that talks about human development and psychology to maybe try and help you figure out a little bit more about why you do what you do. And last time we were talking about preventing teen pregnancy, and we're going to take back up on that. The problem of teenage pregnancy requires a multifaceted solution. So it can't just be, you saying, don't do it. Save it for marriage, because, like I said, we remember when we were hormonal teenagers and waiting was not really something we were going for. So, you need to come at it a number of ways. You need to have the talk with them. You need to tell them, I'd prefer you wait to marriage, but if you just can't wait, here's where you can go, get some birth control. Don't become, mother at the age of, 14 or whatever. Do this. Use a condom so you don't get STDs. There are ways to come at this to keep your child safe. It must include programs and policies to encourage postponing or refraining from sexual activity. Because, like I say, just because you start having hormonal discharges, whether it be male or female, does not make you a man or woman. Now, back in the olden days, as soon as girls started having periods, she's a woman, let's marry her off. As soon as boy, you need to start looking for a wife. But now we know that maybe then they might have been mature, but nowadays a 13 or 14-year-old person is not mentally mature just because they're physically maturing, and they're not fully physical mature, because sometimes 18, 21, 23, before all the bones harden and you become a physical adult. So you need to let these younger folks know just because you think you're grown doesn't necessarily mean you're grown. It's like my grandma told me one time, because my dad was talking about being a man and blah blah blah, and how he went off on his own, and she's like, yeah, but 23 years didn't make a man, so he didn't care for that. But it also must recognize that many young people do become sexually active and need education and information to prevent pregnancy and infection. Because like I say, you can say anything you want to the kid, but the kid is going to make up their mind on their own. So you need to give them wise information so they can make wise decisions. And unfortunately, at this age, their peers are going to be a bigger influence on them than you are, parents. Sorry to let you know that, as if you didn't probably already know, but it's a fact. So you need to give them information so they can make smart decisions for themselves, because not all of them are going to abstain. That's just the facts. And you don't want your child to have a child they don't want, and you don't want them to have an STD that might follow them for the rest of their life. Ultimately, it requires attention to underlying factors that put teenagers and families at risk, reducing poverty, school failure, behavioral and family problems, and expanding employment, skills, training, and family life education. Because like I said, not all children are going to abstain. And I knew a girl, like I said, the parents threw her out of the house. She ended up being homeless, having some more kids. So what kind of future does that family have? Not a great one. And again, poverty. If you're out on the street, and you can't get a job, you have this little child to take care of. Now there are unwed teen mother homes. There was a church down the road who had one. There's one downtown, but that doesn't happen in every city, So by having this teenage child that you kick out, take care for themselves, you've then doomed them to poverty. So again, that family is going to be stuck there. Excuse me. Some parents make their kids drop out of school. I was in ninth grade with a girl who got pregnant by her 17-year-old boyfriend. Her mother made her drop out of school. She had planned on going to school, and she wanted to go into fashion. She wanted to go to college. Her mother made her drop out and, stay home to take care of the baby. So, how's that going to work for her? It's probably not. She might have went back later. I don't know. I lost track of her, but, behavioral, there's going to be some issues there, because the parents are generally not happy when this happens. So there's going to be some acting out, and family problems, needless to say. Again, employment, the parents may or may not be on board with babysitting. They might not be able to. It just all depends. So again, this puts a child in a bad situation if they become a parent, years before they're really ready to be. And again, skills training, there are programs. My youngest son went to a work ready program in his high school. So there are programs, that can get a kid from high school out into the world. A lot of schools don't advocate that. It's become more in vogue to try and force the child to sign up for a college. I think high schools get a little kickback from that. So, and again, family life, education. We had home ec and everything, and there was in high school, there was part of the class was having a baby. They had a little, some of them had like the eggs, and then some of them had like the baby dolls later on. So, there are classes to teach these things. But, I think it's better if we don't have our kids having kids. It's better for everybody. Because adolescents who have high aspirations are less likely to become pregnant, programs such as Teen Outreach, which focus on motivating young people to achieve and raising their self-esteem, not merely on the mechanics of contraceptions, have achieved some success. So again, the kids, they need our help. And like I said, not all of them are going to wait. Not all of them are going to listen to you. So you need to teach them, how to have sex responsibly, because they're becoming sexual beings. They're being filled with hormones. And this is a drive, it's a drive. Like out in nature, as soon as that animal, and we are animal, we're not vegetable, we're not mineral, reaches sexual maturity, they start breeding. Humans have a higher brain. We are more capable of holding that desire in, but not always. So sometimes, it's going to happen. And if you have your child, like I said, when my kids were in school, we got to know, so is it okay for your child to go to this group where they're going to be talking about sex ed? And I was like, why would they even ask? But I understand, having dealt with some parents around, that not everybody's on board with that. Personally, I think that's ignorant. That's just my opinion. Because why would you not want your child to know how to be sexually responsible so that they don't get an STD that's going to follow them all their life, or they don't have children that they're not ready to take care of? I just don't know. This suggests that teenage pregnancy and school failure are not isolated problems, but are part of a larger developmental picture, because kids who are not doing well in school, who don't feel good about themselves, they might have low self-esteem, are more likely to act out, and part of acting out can be having sex. 1 in 3 cases of STDs occurs among adolescents. Let's look at that number again. 1 in 3 cases of STDs occurs among adolescents. What's that tell you? Kids need to be taking more precaution. Wrap that rascal, as the saying goes. The chief reasons are early sexual activity, which increase the likelihood of having multiple high-risk partners. So again, if the kid starts early, those are probably not love relationships, and it's more likely you're gonna dabble. Oh, I'm gonna try this guy. I'm gonna try this guy or this girl or that girl. And then they end up with STDs. Failure to use condoms or to use them regularly and correctly, because there is a correct way to wear a condom. You're supposed to put it on all the way, pinch the tip. I'm not going to get one and show you. But you get the idea. So, teach your kids. Let them go to the sex ed class, so that they're going to make good choices for themselves. And for women, the tendency to have sex with older partners. Because, like I say, girls usually date older boys. Because the boys their age, we mature about, on average, 3 years faster than boys. So boys our age are still usually pretty immature for us. We want an older guy who seems more mature. Although teenagers tend to view oral sex as less risky than intercourse, a number of STDs, especially pharyngeal gonorrhea, can be transmitted in that way. So yeah, do you want your girl or your homosexual boy to have pharyngeal gonorrhea? No, so you need to talk to them about oral sex. That there is also a risk there. I'm sure there have heard. You don't even want to know what I heard from some people. But anyway, there are ways. It might not be what you want, might not be the experience you want, but just you want to keep your kids safe. You want to tell them, and you want to be safe. So the most prevalent STD, according to some estimates, is human papillomavirus, HPV, which sometimes produces warts on the genitals. Now, they now have a vaccination for that. My kids got the vaccination for that. Because, and the pediatrician was like, oh, we got this vaccination. A lot of people, but, it's there if you want it. And I was like, yes. And they had to, get one shot and then come back and get the next shot. But, why not protect them from that? That's what I feel like. Do you love your kids? Yes, protect them from this. That's how I feel. Next is trichomoniasis. That's a word. Which is caused by a microscopic parasite. Again, is that something that you want in your child? No. So you need to talk to them about being responsible. Both HPV and genital herpes, a chronic, reoccurring, often painful, and highly contagious virus, have been associated in women with increased incidence of cervical cancer. So, again, you would want to protect your daughter, if you loved her, from these diseases. So, you need to teach her how to be responsible, when she's having sex. The most common curable STDs among teens, especially among girls, are gonorrhea and chlamydia. So yeah, it happens. You can go get treated for it. But again, precaution, stitch in time saves 9, as the saying goes. Why wouldn't you want to protect her from that? I would think you would. If you loved her, I would. These diseases, if among teens, undetected and untreated, can lead to severe health problems, including in women, pelvic inflammatory disease, or PID, a serious abdominal infection. Abdominal, did I say that right? Abdominal. My tongue. Don't have a stroke, really. It just messes up your whole deal, especially if it affects your speech center. But that can be a serious infection that, travels with you for the rest of your life. You need treatments and things. It can, make you sterile at some point. So, again, if you want to protect your children, do this. I don't want to get into the religious implications and the belief system, blah, blah, blah. Do you love your kid? Be responsible. Teach them to be responsible. Goes down to that. Fully 40% of chlamydia cases are reported among 15 to 19-year-olds. Let's say that again. 40% of chlamydia cases are reported among 15 to 19-year-olds. So almost half, 40% of chlamydia cases are from teenagers in high school. What's that tell you? You need to tell your kid how to prevent that. More than 1 in 10 teenage girls and 1 in 5 boys are affected. And the fact that twice the amount of girls as boys says that the girls have probably had twice as much, 2 partners, whereas the boys might have had 1. Again, like I said, you need to talk to your kids about this because these are things that can follow them the rest of their life. When it comes to sex, one mistake can mess up your life. It's that simple. The human immunodeficiency virus, or HIV, which causes AIDS, is transmitted through bodily fluids, mainly blood and semen, usually by sharing of intravenous drug needles or by sexual contact with an infected partner. So, you need to talk to your kids about this, that AIDS is a real thing. It can kill you. Again, protected sex is a way to prevent them from getting this. If you love your kid, you wouldn't want them to get AIDS, right? Yeah? And again, hopefully, you need to talk to them about drug use as well. They should not be using drugs. They should definitely not be sharing needles with other people, because that's a good way to get AIDS and, die from that. So, again, nothing should be off the table. You should be able to talk to your kids about everything. Drugs, sex, whatever. My kids were kind of shy sometimes talking to me, Mom, what do you think about this? And then I'd tell them and we talk about it, and no subject was off the table, So you should be that way with your child, It's your job to raise your child, to teach them everything that they're going to need to know as an adult. So, putting stuff off, glossing things over, or being so authoritarian that you don't have any discussions with them, you just want to be the boss. I said no. They don't learn anything that way. You're not teaching them anything, you're not helping them. The virus attacks the body's immune system, leaving a person vulnerable to a variety of fatal diseases. So not only the AIDS is the problem, it's the fact that it, basically starts killing your immune system, so that you're now not gonna block these diseases. Your body can't block them, and you can get all kinds of diseases where normally you might not be that big a deal. You get the flu and you get some sniffles. You have AIDS, you might get the flu and die from it. And people die from the flu every year. I understand that, but it's gonna weaken you so much. And like I said, protect your kids. You wouldn't want your child to have this and die from this. So if you love your kid, tell them. Symptoms of AIDS, which include extreme fatigue, fever, swollen lymph nodes, weight loss, diarrhea, and night sweats, may not appear until 6 months to 10 or more years after initial infection. So, it might not be obvious right away. And excuse me. It might not be obvious till about 10 years later, a decade later. So, think about that. If you got AIDS from a partner, as a teenager, you might be in your late 20s before this shows up. And how many people have you had sex with between then and then? And you could have infected all of these people. So, again, sex responsibly. Worldwide, about 1/3 of people living with HIV are ages 15 to 24. So, again, our young people. And the overwhelming majority live in developing countries. So, again, the majority of them, and of course we know it started in Africa, and a lot of them over there, young people with AIDS. And the mortality rate is pretty high. It doesn't say it here right now. But again, if you love your child, you need to explain these things to them so that this doesn't happen to them, so they can take precautions to make wise decisions for themselves and others. In the United States, a total of 219 teenagers have been diagnosed with AIDS since 1981. So, in this country, we're a little bit better about educating the kids. And of course, with the AIDS scare back in the 80s, a lot more teenagers decided it's better to, wrap that rascal than die of AIDS. So, we've gotten better over here. STDs are most likely to develop undetected in adolescent girls. So, girls are more likely to not be symptomatic than boys are. And the reason for that is the biological structure of things. It's not as obvious as it would be on a boy. So, girls might go a little bit longer before they're diagnosed with things. In a single, unprotected sexual encounter with an infected partner, a girl runs a 1% risk of acquiring HIV, a 30% risk of genital herpes, and a 50% risk of gonorrhea. So, teenage girls, half the time they have sex, they're going to get gonorrhea. 30% of the time they're going to get herpes, and 1% of the time they're going to get AIDS. So, again, why would you not, if you love your child, explain this to them and tell them to make wise decisions for themselves? Regular school-based screening and treatment may help to control the spread of STDs, especially when paired with programs that promote abstinence or postponement of sexual activity. So, like I said, there are schools that have clinics. We did not have, we had a, nurse, and there were condoms available in the office. But some schools have, clinics like this, and it's not a bad thing. It's really not. Responsible decision making, again, they need to make responsible decisions for themselves. If they want to have sex, if they're going to have sex, make responsible decisions for yourself and others. And ready availability of condoms for those who are sexually active, at one point, when I was in my 20s, I had to go off the pill because it was too strong, and I was on the mini pill even, and was having pregnancy symptoms, throwing up and, all this stuff. And so they took me off, and I had to go to the clinic and get, bags of condoms because I was, in a serious relationship with someone at the point. So, just make good decisions. All right, we're going to talk about common sexually transmitted diseases now. Oh, joy. Okay, we're going to talk about disease, the cause, the symptoms in a male and female, the treatment, and the consequences if untreated, because a lot of people don't bother. And, that's a good way to cause a lot of problems for a lot of people. Now, we're talking about chlamydia. It's a bacterial infection. In a male, it causes pain during urination and discharge from the penis. In women, it causes vaginal discharge and abdominal discomfort. So again, if you notice these things, time to talk to somebody about it. The treatment will be tetracycline or erythromycin. Ugh. Gosh, don't have a stroke, I'm telling you. If it goes untreated, it can cause pelvic inflammatory disease or eventually sterility. So it can be serious. So if you notice problems, the discharge issues there, you need to go to the doctor and have yourself looked at. Trichomoniasis, that causes a parasitic infection, sometimes passed on in moist objects such as towels and bathing suits. The symptoms in a male are often absent. The symptoms in the female may be absent or may include vaginal discharge, discomfort during intercourse, odor, or painful urination. So again, if you notice any of these things, go talk to the doctor. The treatment is an oral antibiotic. So see, These things can be easily treated with a cream or a pill, and you're good. So uh, why get them in the first place? The consequences of untreated may lead to abnormal growth of cervical cells. What happens if you have abnormal growth of cervical cells? More likelihood of cervical cancer, right? Gonorrhea. It's a bacterial infection. The symptoms in a male are discharge from the penis and pain during urination. Symptoms for a female are discomfort when urinating, vaginal discharge, and abnormal menses, which is your period. The treatment is penicillin or other antibiotics. And what happens if you don't treat it? It can cause pelvic inflammatory disease, or eventual sterility can also cause arthritis, dermatitis, and meningitis. So that one's pretty serious there. Gonorrhea is something you definitely want to treat if you get it, but better yet, why not protect yourself so you don't get it? HPV, or genital warts, the human papillomavirus. Like I said, they have the vaccine for it now, which I got for my kids. The cause is human papillomavirus. Symptoms in a male are painless growths that usually appear on the penis, but may also appear on urethra or in the rectal area. Symptoms for a female are small, painless growths on genitals and anus. Also may occur inside the vagina without external symptoms. The treatment is removal of the warts, but infection often reappears. And if it's not treated, may be associated with cervical cancer. In pregnancy, warts enlarge and may obstruct the birth canal. So, you can get cervical cancer from this, and it can cause you problems if you're wanting to have kids. So again, if you have any of those symptoms, go have a doctor look at you. Better yet, protect yourself. Herpes. People talk about herpes all the time, don't they? And the cause is herpes simplex virus. The symptoms in a male are painful blisters anywhere on the genitals, usually on the penis. And for a female are painful blisters on the genitals, sometimes with fever and aching muscles. Women with sores on cervix may be unaware of the outbreaks. So if you're having outbreaks on the inside, you might not be aware of it because you're not seeing it. The treatment is no known cure, but controlled with antiviral drug acyclovir. So, again, you have symptoms, go get treated. Better yet, protect yourself. And the consequences of untreated, possible increased risk of cervical cancer. So, like I say, these things can be serious. Hepatitis B. The cause is hepatitis B virus. Symptoms in male are skin and eyes become yellow. Symptoms in female is the same as in the man. The treatment is no specific treatment, no alcohol. So again, this can be a very serious thing. If it doesn't get treated, it can cause liver damage, chronic hepatitis. So, Hep B can cause worse ones. So, syphilis. It's a bacterial infection. In the male, in the first stage, reddish-brown sores on the mouth or genitalia or both, which may appear and disappear. Through the bacteria, though the bacteria remain, in the second, more infectious stage, a widespread skin rash. In the females, same as in the men. So if you notice any of these, you need to go to the doctor. Treatment is penicillin or other antibiotics. If not untreated, excuse me, if left untreated, the outcome could be paralysis, convulsions, brain damage, and sometimes death. And a lot of people in the old days died from syphilis because they didn't know, they wasn't treated, and so again, protect yourself. AIDS, acquired immune deficiency syndrome. The cause is human immunodeficiency virus, or HIV. The symptoms in a male are extreme fatigue, fever, swollen lymph nodes, weight loss, diarrhea, night sweats, susceptibility to other diseases. And in the female, the same as in the men. So again, if you got any of these symptoms, go get checked out. The treatment is no known cure. Protease inhibitors and other drugs appear to extend the life. And what happens if it's untreated? Death, usually due to other diseases such as cancer, because like I said, it destroys your immune system, so it leaves you more vulnerable, to other diseases. teenage pregnancy and childbearing. More than 10% of all U.S. births are to teenagers. 10%. Most of them outside of marriage, of course. We're talking about probably high school teenagers. Most teenage pregnancies are unintended, and about 1/3 end in abortion. And isn't that a shame? More than half of pregnant teenagers have their babies and plan to raise them themselves. And so, again, more than half, so that means half don't make it. But a lot of teenage girls, they want to take that responsibility on. They think they're ready, and a lot of times they're not, and that's a shame. A lot of times, grandmas, aunties, whoever, their parents end up, raising the kids, and that's a shame. So wouldn't it just be better if we prevented that from the beginning? Some miscarry, and a few place their infants for adoption. And that's what, everybody thinks, give the baby up for adoption, give it up for adoption. And there's a lot of kids, so many kids, waiting to be adopted who never get to be adopted. I mean, we have a exit program here, a few halfway houses where, the kid comes out of the system at age 18, and then they can go to these other places and do these other things. But, I mean, then they really have no support system, So, this kid may or may not get adopted. So when you're putting it up for adoption, you're basically just gambling. You're rolling the dice of the kid might get someone to take care of them, but they might not. And they might be in an institution all their life, and then they grow up thinking nobody wants me. I've met people like that, and they end up self-destructive. So again, wouldn't it just be better if we prevented that from the beginning? Because our teenagers aren't making great decisions for themselves, obviously. So what makes you think they're going to make good decisions for the children that they're having as teenagers? And that's where I'm going to leave you today. I hope that helped you figure out maybe a little more about why you do what you do. Please like this educational program and share it so we can spread it around the world. If you want to help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. That's all for now. Until next time.